And we are back from break. It is 2:30 p.m. and we are picking up with our public hearings for Health and Human Services, for Public Health and Social Services, and Emergency Services. Robin, I'm handing it back to you.
Thank you, Commissioner. As you said, this afternoon during this hour, we will hear from two departments, and I'm just going to move right in to Public Health and Social Services. Public Health and Social Services is currently led by Acting Director Kurt Harden, and this is a very large department with a broad mandate. The core services are public and environmental health, including disease control and prevention, food and water safety, affordable housing, behavioral health treatment, services for developmentally disabled youth and adults, and services for veterans are also included in Public Health and Social Services. So we're gonna break this down into two parts. The budget for public health does quite a few things because this department received a increase in grant funding from the state of Washington for foundational public health, along with addressing a few other things in their budget. But the board was able to approve quite a few items for 2023, including the addition of a program assistant 2 for disease control case investigation support. There are financial staff to support the programs. There is the addition of an environmental health business application analyst. There is a community health nurse 2 for child death review and injury violence prevention. This budget adds another community health nurse 2 to improve access to healthcare and resources for families. There's the addition of an education and outreach specialist 2 for maternal child health. And this budget removes end dates on staff that will facilitate hiring and filling positions. There is also grant funding, and as I stated, a large increase in foundational public health. There's funding increase for environmental health from I'm going to have to ask for someone to interpret these acronyms. I'm not quite sure what those are. And then Perinatal Mental Health Department of Children and Youth Families grant has also been received by the department. And Kurt, can you interpret NEP, OSS, NTA? We have alphabet soup going on.
National Environmental
Protection Agency.
Yeah,
Okay, well, we'll get clarification on what these acronyms are.
Oh, National Estuary Program.
Ah, great.
On-site
Thank
septic.
you. For on-site septic, OSS, and NTA is.
I will have to get back to that.
Well, we'll figure this out. So wonderful grant funding for environmental health. On the social services side of this department, there is funding for a veterans assistance program pilot project. This project would provide food and wraparound services to veterans. And there is the removal of position end dates, again, to facilitate filling vacancies. The department has 136.2 FTEs, a very small amount of general fund appropriated to this department, $109,000 in 22, $112,000 in 23, but in total funds, $77 million in 2022, and just under $64 million in 2023. A large amount of that funding is for affordable housing, And you see it go down because the amount of money that we're receiving through federal and state grants to address COVID and emergency housing assistance will probably not carry into next year. So with that, I'm going to invite Kurt to come to the podium and make comments.
Good afternoon, Commissioners. Kurt Harden, Interim Director for Public Health and Social Services. First of all, I'd like to thank you for the process to resource the department through the budget process. I know we've had a number of discussions over the last several months, and so I think all this is just a recap for you as you've asked some really good questions as we work through some of these areas. I can't add too much to what Robin has mentioned here, other than to be able to sit here and answer questions. But again, I appreciate the support the commissioners have given to the Public Health and Social Services Department. I'm not going to speak too much because my voice is going with each word.
Thank you. Commissioner Edwards?
No, but for the public, I might mention that we've been going over this budget for months now, and that might explain why the board doesn't have very many questions, I guess. So, no, thank you all for your job. Thank you for your extra service. Beyond is fill in here. Thank you.
Thank you. Questions?
No.
Kurt, I'm going to echo what Commissioner Edwards just said. Thank you so much for all the work that you've done this year as the interim, and hopefully you won't be the interim much longer, knock on wood, but just really wanted to thank all of your hard work. Definitely did not expect you to be walking us through the budget process for public health and social services, but you know, you've done a great job, and you know, thank you for that additional work. So, County Manager.
I'd just like to echo, and nothing from my part but gratitude to you, Kurt. You have an incredible sense of service and an incredible sense of duty. And you have really keeping us going on this transition year. And nothing but appreciation. Thank you.
Thank you. And I have to say, though, that I have to give a big shout out to the staff over at Public Health and Social Services. They brought me up to speed, or at least up to where I am today, and they worked really hard to help me understand and answer my questions. So a lot of great folks over at Public Health and Social Services, and I appreciate all of them. And then I'd also like to thank the staff over at Emergency Services, because they filled in and did a lot of things they weren't supposed to be doing, but they're still doing it. So thank you.
Thank you. Okay, so are we ready for public testimony?
We are.
There is no one in the boardroom. Do we have anyone via?
Nobody in Zoom, Madam Chair.
Okay, so
Comments? All right, well, moving right along then to emergency services. Kurt Harden is normally the Director of Emergency Services, but while he is filling in with Public Health, we have Acting Director Ben Miller-Todd, who's with us this afternoon. Emergency Services does two major functions. One is the support of Medic One throughout the county, and the other is emergency management, preparing the county for any natural or man-made disasters that may come our way. This budget for 2023 increases funding for basic and advanced life support, contract and operating costs. There's funding for emergency management radio replacements, and there is grant funding for the FEMA public assistance for 21 and 22 expenses. And just to explain that, FEMA reimburses counties, and they are, it's not unusual for them to be slow, so we have just received grant funding to cover disasters that happened last year as well as this year. FTEs in this department, 21.5 FTEs each year. General fund for emergency management is $350,000 roughly, or 2.4 million, and 23 also 2.4 million. Total funds, which include the Medic One Fund, as well as general fund, 19.9 million in 2022, 22.2 million in 2023. And Ben or Kurt?
Thank you very much. I get to reiterate my thanks for keeping us honest throughout the year. I think asking a lot of questions and making sure that everybody understands the direction that we're going for Medic One and emergency management are important. Emergency management and Medic One both look outwardly when we're serving the residents of Thurston County to both respond to disasters, which you saw in the 2022 flooding this year, as well as responding to an increased number of EMS calls in a variety of 12 of our partner agencies throughout the year. I think it's important to be able to justify all the decisions that we're making, and all of your questions, knowledgeable questions, have really, really assisted in the budget development process. With that being said, I will pivot just a little bit, and I will also thank Robin and her team, the budget office, for helping us to manage all of these requests as they come through and get them in front of you in a timely manner. If you have any questions about the budget requests that we've submitted, please let me know. Thank you.
Thank you. Questions? Commissioner Edwards.
Ben, out of your 21.5, where you at on FTEs?
The 21.5?
Yeah, I'm just curious, that's how many you're allotted. How many do you have?
Currently,
You have a few empties, I think.
we're 4 short. So math on the fly is 17.5, but we're 4 short. 1 in emergency management, 3 at Medic One at this point in time, if you don't count our loan to public health.
The loaner?
Thank you.
Joke.
Thank you.
That was a joke.
That's it for me.
Thank you, sir. Commissioner Mensah.
No questions, thank you.
Ben, also a thank you to you for really stepping up this whole year and keeping us updated. I mean, at least for me, I know we had our monthly check-ins where you were keeping me up to date on emergency services and what was going to come up, and getting me prepared. So just very appreciative of all the work you've done and for stepping up really during this series, as we've taken Kurt away from you and stepping into that role. So huge thank you.
Absolutely, and I will also pass that along to both EM and Medic One staff, who also got to fill in a lot of those positions. So thank you.
Thank you so much, Ben.
Thank you very much.
Okay, with that, we will move on to public comment. There's no one in the boardroom.
And I have no one in Zoom, Madam Chair.
Okay, so with that, any additional comments or questions from the commissioners? Commissioner Edwards? Commissioner Mensah?
No?
No? Okay, so it is 2:44, and we will take a break until our next meeting at 6 p.m. Is that correct?
The budget
Four.
hearing continues for open comment at 6 p.m., but at 4 o'clock, we have the public hearing on revenue.
Yes.
And then at 5 o'clock, there is the public hearing on the water and sewer utility rates. So,
I was following the slide,
Right.
and I was like, wait.
yeah,
this is not right.
big gap there. No recess until 4 o'clock. And again, deep appreciation. Thank you both for being here this afternoon, and to all of your staff on the work they've put into the budget.
So we will be on the same Zoom, and if you would like to provide public comment on the biennium midterm budget, revenue to support the budget, please join us at 4. So we are on break.